Welcome to the MedEvidence podcast. This episode is a rebroadcast from a live MedEvidence presentation.
Thank you all for being here, and this is a lot of fun, especially for me. Dr. Koren and I have a lot of fun every Monday morning at about 8:25 on WSOS 103.9 in St. Johns County and St. Augustine. We do a live call-in exchange, and it's often topical. It has something to do with medical news that's been going on over the last couple of days, and we don't ever really know what the topic is until about 8 o'clock Monday morning, but it always seems to work out really, really well. So we've been doing that for a number of years. So the thought was that we would bring it to you all today in sort of an elongated form and talk about medical conspiracies and medical information and how you get your health news from hopefully some pretty reliable sources like WJCT and also WSOS and St. Augustine.
And MedEvidence.
And MedEvidence, that's right. We talk about that every week. We try to push people to take a look at the website MedEvidence.com because so many folks just want to go to Dr. Google. And as I always laugh, Dr. Google always ends up with everybody dying from cancer. So, whether you start out searching, I have a pimple on my cheek, you're going to die from cancer. So you're not going to find that with MedEvidence. You're going to get good information. And we're just trying to get the word out so that more folks utilize it.
Yeah. And the title here is Finding the Truth Behind the Data. And that's the tagline for MedEvidence, which is our platform to discuss medical findings, medical problems, medical dilemmas, and also getting people involved in clinical research, which is my day job. Mm-hmm. So we find this to be a great way for people to know what's known in medicine for any particular problem, what's not known for any particular problem, and how we're going to discover the truth.
Right.
So without further ado.
Yeah, so we like to set this up where if there's some of you that are new to this, where we kind of throw out audience questions, if you will, and then Dr. Koren kind of helps us get to the right answer. So one of the first questions we want to ask for the audience is, what is the first step in the scientific method?
Yeah, so we like to say that there's no free lunch. So you come here, you listen to us, you get some food, but you got to work for this.
Yeah.
So this is how we get some audience feedback and also learn what different audiences know and don't know about whatever the medical issue is.
Right. There will be a test at the end. So what is the first step in the scientific method? To A, formulate a hypothesis, conduct an experiment, make an observation, analyze data, and then draw a conclusion. And of course, there's always healthy skepticism, right, Doctor?
Yeah. So out of curiosity, who thinks the first step in the scientific method is A, formulate a hypothesis? Okay, a few.
It's pretty good.
B, conduct an experiment. C, make an observation. Interesting. D, analyze data. E, draw a conclusion. Or F, healthy skepticism. So we had that one guy in the middle who jolted up his hand right away, and you're correct, my friend. So before you do anything in the scientific method, you need to have a healthy degree of skepticism. Do not fall in love with your hypothesis. Do not fall in love with anything, but you should be looking at this to try to discover the truth and be skeptical about what the whole process might look at. So healthy skepticism is actually the right answer here.
So our audience question number 2. Which of the following do medical scientists consider the gold standard in research? Your options are A, case study, B, observational study, C, randomized controlled trials, D, epidemiological studies, and E, quantitative meta-analysis.
All right,
So
same thing here. Who thinks it's A? Who says B, observational study?
Got a couple.
Who says randomized clinical trial?
There we go.
Oh my God, this is a very smart audience. Who says D, epidemiological study? And who says E, quantitative meta-analysis? Who knows what quantitative meta-analysis is?
Yeah,
Okay,
they all do.
We got
smart audience.
We got one hand, a very smart audience. And the answer is, in fact, C, randomized controlled clinical trial. And we'll talk a lot more about that. But that is actually considered the gold standard in medical research. And it's actually the basis of evidence-based medicine. And everybody in medicine that's worthwhile will say that we need more evidence in evidence-based medicine.
So, here's another question for you. Why would we want to address conspiracy theories, which have certainly been out there since the COVID time? Number one, I guess it's fairly entertaining, right?
It is.
Yeah. We want to try to encourage a little critical thinking. We want to educate the public on the science, if possible, and that's what Dr. Corrin's especially good at. Promote accurate and reliable information, which is what MedEvidence.com is all about. And then uphold trust in the medical research that we read about.
And probably most importantly is so that you can make good decisions for yourself and your family when it comes to healthcare issues. So this is not a multiple choice question, it's all the above, clearly.
Right. So what is the scientific method, right? The process used to validate observations and answer questions in a fair and unbiased manner. A sequential process that generates clear outcomes and increases our knowledge. And then we use deductive reasoning to uncover truths, right, Doctor?
Absolutely. So this, again, these are all true things. And I'm going to spend a little bit of time with you to explain what deductive reasoning is, because this is the basis of evidence-based medicine, and it's the basis of good decision-making. And good decision-making depends on using deductive reasoning rather than inductive reasoning to understand what the issues are and then to decide what your course of action is. So let's break this down a little bit for the audience. Deductive versus inductive reasoning. Deductive reasoning is defined as something that follows the rules of logic. And basically it says, if all premises are true and the terms are clear, then the conclusion reached is necessarily true. That's the definition of deductive reasoning. Whereas inductive reasoning, and that's kind of how we go about our lives because we don't always have all the information we need. But inductive reasoning means it's a body of knowledge or series of observations that become synthesized to form a hypothesis. So when we're generating a hypothesis, we use inductive reasoning. When we're trying to prove a hypothesis, we use deductive reasoning. So the conclusion of an inductive argument is always probable, not necessarily true. Mm-hmm. So this sounds a little nerdy, and I realize that, but it's an important philosophical, theoretical basis for the practical things that we're going to talk about. And this is a practical thing. I'm going to give this example as a practical thing that shows the difference between inductive reasoning and deductive reasoning. So we call this the great milk caper. Has it happened to you? So who in the audience has children? Okay, most people. Who in the audience has had the situation where your kids or other people haven't put a perishable back in the refrigerator after using it? Okay, so it's a pretty common scenario. Okay, so I'm going to lay out this scenario for you. You return to your home from errands on Saturday morning. You get out into the kitchen and notice a carton of milk left out. The carton is warm, and you become irritated. You have reprimanded your 10 and 14-year-old kids to put perishables back into the refrigerator after use on numerous occasions. You summon them for their hearing and sentence. Okay. Your 14-year-old, fresh from criminology camp, listens to the allegations. Then she pulls out a fingerprint kit and establishes that the only fingerprint on the carton belongs to you. Snap, you recall, I did take out the milk for coffee right before I got the emergency phone call to go down to the office, and that was after the kids left for camp. You withdraw the charges humbly. So this is a great example,
right,
Kevin, of something where you make an immediate conclusion based on experience, and maybe the kids mostly are responsible for this, but in this particular case, they weren't. And this is the difference between inductive reasoning and deductive reasoning.
Right.
All right, so now let's transition that to drug development. So it's interesting is that you get a lot of skepticism about the pharmaceutical industry, but usually half the crowd would go to a gypsy that was cooking up something in their backyard.
What could go wrong?
Yeah, but the funny thing is that this is actually how drug development worked in the 50s. So before we had a lot of regulation, basically you can put anything together, and the only thing that was required from a drug company was a list of ingredients. And sometimes it worked, and sometimes it didn't. So a lot of stuff that we take every day that we take for granted was actually developed during a time when there was no regulation, there was no clinical trials, there was no knowledge about all these things. And people kind of, sometimes just took it and they went for it because Madame Ruth recommended it. But in fact, maybe that's not always the best thing. So anyhow, so the point here, of course, is that the development of medical products has evolved over the years.
Right.
And it's very regulated these days. It's incredibly sophisticated. And we still have issues, though, about this. So it's funny. This actually was a discussion point that happened with one of my patients and lots of other patients. So some of you may know this, but I was the principal investigator here in Northeast Florida for the Pfizer COVID-19 vaccine. Mm-hmm. And we had some people that came in and said, well, I don't trust Pfizer. What do they put in that vaccine? They're up to no good. And then I actually learned this from an African-American physician at a national conference. He says, well, when I get that comment, what I ask my patient is, do you take Viagra? And did you know that Pfizer developed and owns Viagra? And you seem to be able to take that okay, so you can trust them for that, and maybe you can trust them for this other thing.
All right.
And it's a very, very interesting point that this physician made. Mm-hmm. And I think it's relevant for this discussion. So go ahead, let's go to the next audience.
So our third audience question, which of the following procedures or products were tested in randomized, blinded clinical trials prior to release?
This is a really interesting question.
Aspirin, frontal lobotomy, the mRNA COVID-19 vaccine, or thalidomide.
And there's one more.
Oh, and morphine. Yeah, can't forget that.
All right, so which of the following procedures or products was tested in randomized, blinded clinical trials prior to release, meaning that the others were not? Was it aspirin? Was it frontal lobotomies? Was it the COVID-19 vaccine?
Yep.
Thalidomide? No, it was morphine. Okay, so we don't use frontal lobotomy anymore, thank God, but the other things are actually being used, and they've never been tested in clinical trials except for the COVID-19 vaccine. So that's the right answer. And these are just talking about some of the other things that were done again back in the 50s and before we had regulation and actual clinical trials. So thalidomide was actually widely used in Europe without clinical trials. And as you probably know, it was prescribed for pregnant women who are having morning sickness and unfortunately caused birth defects. And you've seen kids that have truncated limbs from thalidomide. But it actually was not a big problem in the United States because of one person. Her name was Frances Kelsey, and she was a physician working at the FDA in the early 60s, and she was looking at the information that was coming in from Europe about thalidomide, saying that this is the new wonder drug for women. And she said, well, what about the safety? Did we ever test the safety? And because there was no information from the drug company about safety of thalidomide, she did not allow thalidomide in the United States. One person, FDA, protected thousands and thousands and thousands of people from birth defects because she would not let thalidomide in the United States. So you probably never heard of Frances Kelsey, but she is a hero in our world.
Right.
And if you go to the FDA headquarters, they have a really beautiful display of her work. And so, but that was the way things worked. There were no formal regulations, and we were just dependent upon the good nature of certain people that cared about the public.
So what made doctors in Europe think that thalidomide was something that they should give?
Again, it prevented nausea.
Oh, okay.
So it was a drug that prevented nausea. Pregnant women get nauseated. It's tried in pregnant women.
Right.
And the attitude in those days is we didn't have to prove safety. If it seems to work in the first patient, try in the second patient.
Yeah.
If it works in the second patient, try in the third patient. And of course, when you're dealing with pregnant women, you don't know what the consequences are until after the children are born, which is now months down the road, or maybe even longer than that.
Right.
So because of that, there was a big problem with thalidomide in Europe, but very, very little problem in the U.S.
Right.
And then, who knows here that frontal lobotomies actually won the Nobel Prize in medicine? Can you believe that? So back in 1949, this was considered a miracle cure for severe psychiatric disorders. And you can see that there was a little brochure that was being sent out to neurosurgeons to show how to do the procedure. Crazy stuff. But this was never tested in clinical trials, but people were finding, okay, if you were having really difficulties with psychiatric illness and you had a portion of your brain cut out, you seem to be more docile after that. And wow, is this a cure? Well, it turns out that when they actually looked at it critically and compared drugs Drugs actually work better for psychosis than this, and of course there are incredible side effects of doing frontal lobotomies. So this has been repudiated at this point. But compare that with the COVID-19 vaccine. So the Pfizer vaccine had 46,331 participants before it was approved by the FDA. By the way, maybe about 700 of those participants were here in Northeast Florida. The Moderna vaccine had about 30,000 participants before FDA approval. About 400 of those were in Northeast Florida. So at every step along the way, we were looking very, very critically to make sure all these things were safe. And fortunately, it turned out to be incredibly safe, incredibly effective, and the people that are involved in the clinical trials got these benefits prior to the general public. So a whole different environment for testing new medical products. So let's talk about some other conspiracy theories and how they develop. So in this actual auditorium, I saw Ira Flatow, who came to that lecture when he was here, a few of us. So I had to bite my tongue during one of his comments, I have to say. I didn't speak up because I didn't want to take the stage away from him. He's very good. I like him, and more times than not, I'll agree with him. But he did make one statement that I find objectionable. And he said that he was talking about the drug development process. He talked about a lot of things in science, but he happened to mention the drug development process. And he says, and this is a quote, this is actually from his transcript, "It doesn't lead to a cure. Drug companies will make a lot of drugs and a lot of money because they don't want to lose a customer. They want to treat you for your whole life. They don't want to cure you. They want to treat you so they can make oodles and oodles of money on people being sick." That's the exact quote. So this quote, I believe, is inaccurate, and also the way kind of conspiracy theories develop, that the drug companies are conspiring not to cure things. The only thing that's true about this statement is that the drug companies do want to make oodles and oodles of money on people being sick. So that part is true, but they will cure people. They absolutely will cure people, and people in the drug development business actually love to cure people. People like to make money, but we also like to be successful. We like to make a difference in people's lives. We like to impact public health. Mm-hmm. And for that reason, there's lots of people always working on cures in the drug development business. And it's easy to show this. So one of the most famous examples is a drug that was developed by Gilead Science called Sovaldi. And this was a drug that was extremely controversial about a decade ago because originally they were asking $80,000 per patient for this treatment. But it absolutely cured hepatitis C. Cured it. Didn't just reduce the levels of the virus, it cured it. And people that took this drug didn't have hepatitis C. Moreover, the dissemination of this drug has almost eliminated hepatitis C from the US. Hepatitis C 10 years ago was by far and away the number one cause for liver transplants and cirrhosis liver transplants. That's all gone away. So now the number one reason for liver transplants is fatty liver disease, is NASH. Mm-hmm. I saw somebody talking about alcohol. That's another one, but it's actually number 2. So hepatitis C was number 1, and that's been cured. It's been eliminated. So yeah, they made oodles and oodles of money, but they actually saved the system oodles and oodles of money by getting rid of the number 1 source for liver transplants and cirrhosis. There's many other examples. Smallpox was eliminated in North America in 1952, eradicated around the world in 1980 through the development of vaccine. Polio, we haven't seen a case of polio in the U.S. that came from the U.S. There's still a few pockets around the world, but slowly but surely that's going to be eliminated. Mm-hmm. So there's plenty of examples of where drug development has actually completely cured, or even better, eliminated diseases. And that's true in a number of different cases in oncology, in cardiology, and elsewhere. So let's talk about some other conspiracy theories. HIV/AIDS was a big one.
Right.
Yeah. So you were working back in those days, weren't you?
Yeah. And so you always heard about things like only gay people could get AIDS, for example. Flying insects could transmit HIV. That was a popular one. Or that it was a virus created in some mysterious lab overseas, right? Which we've heard that recently too.
No, totally. Well, all that turns out to be nonsense.
Right.
And obviously, multiple people can get AIDS. We understood the virus that causes it. We actually understood exactly how that virus moved from an animal reservoir to a human reservoir. Mm. And fortunately, we now have treatments that have turned AIDS from a lethal condition to something that's incredibly manageable. Mm-hmm. And Magic Johnson was a great spokesperson for that.
Yeah.
It's remarkable that when he first came out with discussing that he was HIV positive, it was a death sentence. But it was also the exact same time when drug development groups got together and learned how to treat this very, very effectively. And now we can take people that have been diagnosed with HIV or AIDS and get their counts down to 0. So it's just, again, another example of drug development that has transformed a disease and makes something that was literally a death sentence into something that's completely manageable. All right, so let's talk about COVID-19. There's a lot of stuff out there, and you and I talked about a bunch of this stuff during our phone calls. Ivermectin, do you remember that?
Yeah.
It's basically a pill that's used to treat parasites in animals.
Yeah, horses, right?
Yeah, exactly. Yeah. That's right. And that was being advocated as something to treat COVID. Ivermectin is cheap and effective, but they're trying to discredit it to maintain profits from vaccines. That was the statement that was made. Well, we wanted to analyze it. We wanted to do clinical trials to see whether or not it worked. We didn't want to keep this away from people. And in fact, a lot of people got it because it is on the market, so you couldn't really stop people from prescribing it. But it turned out that when you actually did the clinical trials, and this is a study called the Together trial, we did not participate in this, but if you look at this, is a New England Journal paper that showed, at the end of the day, treatment with ivermectin did not result in a lower incidence of medical admission to hospital due to progression of COVID or a prolonged emergency department observation among outpatients with early diagnosis of COVID. So when you actually did the studies, it did nothing, but it did cause side effects. So this is now considered discredited at this point. Hydroxychloroquine, there's another one that people talked about. Hydroxychloroquine is used all the time for rheumatological problems. And that was being touted as something that could treat COVID. In fact, some people are saying that in observational studies, hydroxychloroquine, by the way, that goes in the name Plaquenil. You might be familiar with that name rather than hydroxychloroquine. But this is a drug that's commonly used as an anti-inflammatory for inflammatory diseases. But in fact, it did absolutely nothing when it was tested in clinical trial for COVID-19. The original observation was based on the fact that some people were getting it and some people weren't. And in an observational setting, there was a sense that maybe the people that were getting it were people that were doing a little bit better. But really what it came down to is the people that were in the worst shape were on ventilators. They couldn't take this drug because it was an oral drug. So all it was doing, the people that were able to take this were people who were less sick. And when you did a randomized clinical trial, you found that there was absolutely no benefit of this therapy. For COVID-19, obviously. It's for other things. And not only did that happen behind the scenes, but the Lancet, probably the most prestigious journal in Europe, formally retracted the original observation article, saying that it's been disproven and formally retracted. So that's how science works, is that we create a hypothesis. We don't jump to conclusions. We don't assume who left the milk carton out, but we actually do the testing.
Right.
Okay, so these are some other things. I know that you love to talk about this stuff, about radiation and crazy stuff like this.
That was all the rage for a while. The whole notion of 5G for your cell phone, was it going to, cause brain cancer or what have you? And it ultimately turned out that was not the case, and we all have 5G probably on our phones sitting here today.
Right. Now, the other thing that's interesting is that it was also supposed to revolutionize our lives in terms of better internet access.
That hasn't worked either.
That hasn't worked either.
Yeah.
So it hasn't done any harm. I'm not sure how much good it's done.
Right.
And there's another famous case.
Yeah.
You familiar with this one?
Yeah, does the MMR vaccine cause autism, right? We've also had other rumors that other childhood vaccines could perhaps cause autism as well, right? That's been greatly and widely disproven, correct?
So it's interesting. You still see a lot of that in social media that, there's a medical argument that vaccines cause autism, but no one really knows the backstory. So it was actually started by a physician named Andrew Wakefield, who's considered a fraudster. He was an anti-vaccine activist, a former physician, and he did a study that was published of only 12 children, 12. And he went out and said that this is proof that there's a relationship between autism and the MMR vaccine. This, again, was put into a medical journal as a hypothesis generation rather than as proof, but everybody looked at it and said, oh, it's in a medical journal, therefore it must be proof. Well, actually, when people actually looked into the details, it turned out that he didn't even do the study. He just looked for some people that had autism and had other people that were willing to say that there was an association without doing a formal experiment like we do in a clinical trial. And the other thing that came out was that there was an attorney who paid him to create information so that they can sue the manufacturers of the MMR vaccine. And when this all played out, the General Medical Council in Britain revoked former Dr. Wakefield's medical license. So unfortunately, what happens, though, is that this conspiracy comes out and then it takes a life on its own, and the actual facts, when the deductive reasoning is put into place, and it turns out that the conclusion is not supported, you don't hear about that.
Right. And given the structure of the internet, that information is still out there today.
It is.
Fluoride in our water supply is a government plot. That's been out there for quite some time. Fluoride can cause cancer and thyroid issues, or fluoride is a byproduct of industrial processes, for example, that it can cause all sorts of issues.
Yeah. And again, the only issue it causes is you have fewer cavities.
Right.
And I think that's been shown over and over again. And again, there's never been a scientific study that shows that there are long-term health issues.
Right.
And what's interesting is that when your teeth are better, your heart is better. So there's a lot of links showing that people that develop gum disease and other problems have more inflammation in their body, which in turn leads to worse outcomes from a cardiovascular standpoint.
Right.
And of course, we have all these crazy theories.
Yeah, all the whole litany of COVID-19 conspiracy theories, right, that we've been dealing with for the last couple of years.
Have you had calls in your radio show after I talked about COVID-19 saying, get this guy off?
Yeah, we usually don't share those with you. But yeah, there's a good percentage of people out there that still believe in most of these, maybe upwards of 30 or 40%.
Yeah. We'll get to questions in a second, but you'll have your opportunity. But yeah, so there's all kinds of crazy things. These are all actual quotes that we've heard from patients, or when we do social media posts or on our website, people will put this information out. Well, the truth is that when you break down COVID-19, it's a devastating illness in people who are vulnerable. And it's a very mild illness in people who are not vulnerable. That's the take-home message. So if you're an 18-year-old and you got COVID-19, you would have a very mild illness, and that wouldn't be much of a problem. But if you brought that home to your grandmother who has diabetes, it's a whole different story.
Right.
And every viral infection has a little bit of a different epidemiology. And we've talked about this on your show, that the Spanish flu was devastating to teenagers. So there's a famous case at Fort Devens in Massachusetts where they had 15,000 recruits for World War I, all healthy 18-year-old men. And a lot of them got the Spanish flu, and 700 died. 700 young people died. But for COVID-19, it was the opposite. If you were over 80 and you got sick, you had a 20% mortality rate, but young people didn't. So the point there is that the vaccine was incredibly protective for vulnerable people, maybe less so for younger, healthy people, except to the extent that younger, healthy people pass it along to the vulnerable people.
Right.
And unfortunately, that very basic logic that's been demonstrated in multiple studies is not necessarily articulated, and people start yelling at each other about, this is all conspiracy. I remember I was working out in the gym, and somebody, very, very interesting comment. I was working in the gym during the teeth of the crisis, and they asked me to wear a mask when I was in the gym, which is fine. And I put the mask on, and I was experimenting with different masks. I actually had a N95 mask, another mask, and I went back and forth trying different masks to see if it affected my ability to exercise. Right. And as I was changing masks, I got reprimanded from somebody that said, keep your mask on. They got really mad at me and said, people like you are causing the spread of COVID-19. They didn't know what I do for a living, of course. And then I started to say what I was doing for a living, and then the person decided that they didn't want to talk to me anymore.
Right.
And then another person said, yeah, I'm glad you put that person in their place. She said, all this is going to go away after the election.
Right. So much for that.
So anyway, you get both sides, and,
Right.
and there was a lot of theories out there. But fortunately, we have an incredible amount of science that tells us really what's going on, and I'll be happy to answer questions about it. So how about social media? I know this is your area of expertise.
Right. So how does social media impact conspiracy theories? The platforms allow misinformation to spread fairly quickly. We all know that. You can basically, do a Facebook post in a matter of seconds, right? Some algorithms tend to, prioritize the more controversial stuff because social media wants to get you engaged, and we all tend to be a little more engaged if something is controversial and kind of gets our ire up, right? Social media can also create echo chambers. We tend to follow people that agree with us, the whole notion that we follow within our tribe, and then we just keep feeding more information to the tribe. All that, and then of course celebrities getting involved even intensifies that, right?
Absolutely, and they're certainly out there. So this gets into how we started by trusting a objective source rather than Dr. Google.
Right.
And what we do in MedEvidence is we have physicians having conversations or other experts having conversations, and sometimes we'll have experts that have different opinions on things. Mm-hmm. And we'll talk about what's known for sure, what's not known at all, and how we're going to learn about the stuff that we don't know about.
Right.
And we have these podcasts that will be anywhere between our quick hitters, we do
7 minutes.
7 minutes or so, where you get a quick hit on a particular area, or hour-long podcasts where you really dig in deep in terms of what the issue is. And we're getting incredible feedback on this. We're getting a lot of people that are saying they find it very enlightening, that they can dig into an issue or get a quick hit, depending on what their time constraints are, and that they can make good decisions for themselves and their family once they have that information, knowing that we're very clear on what we don't know. We know stuff, we don't know stuff, and we're going to try to figure out stuff.
Right.
And once you have that kind of disclosure and transparency, you can make much better decisions.
Yeah.
So to that point, as we speak, there's lots of stuff that we're doing right here in Northeast Florida, answering questions that we don't know the answers to. Mm-hmm. So, for example, right now we're about to start a study using an oral COVID vaccine. So obviously, some people are concerned when you get an injection, but the truth is that you can give vaccines in oral form. So we're about to start a program that's looking at oral vaccines that may be more acceptable for some people. So if you or somebody you know is interested in getting involved with that, let us know. We have people in the audience that'll be happy to follow up with you. I'm a cardiologist, so I'm particularly interested in things that affect heart disease. And one of the questions is, can we prevent heart disease by treating a bad lipoprotein called lipoprotein a? You and I have talked about that several times. Yeah. Who has heard of that lipoprotein a in the audience? So maybe a third. Well, this is what I like to call the really, 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 really bad cholesterol. So most people have heard of HDL, which is the good cholesterol. They've heard of LDL, which is the bad cholesterol, but few have heard of lipoprotein a. But as we speak, 20% of you in the audience has high levels of lipoprotein a. And this is actually a more potent risk factor for heart disease and stroke than LDL cholesterol. But you haven't heard of it because we haven't had a way to treat it in the past. But that's changed. And now in clinical research, we have 4 products that will actually lower lipoprotein a by up to 95%. And we're enrolling in studies that are looking at that. We've already had thousands of people dosed with these products around the world, so we have basic safety information, and now we're just looking to see if it's as effective as we think it should be. Other questions. We had a session here. The last session here was with Dr. Mitch Rothstein, and we talked about some of the work we're doing to see if weight loss can improve sleep apnea. So sleeping problems are very common. Probably a third of all people have sleep apnea at a more serious level that can cause a health problem. And we find that as people lose weight, they have lesser problem with sleep, but it hasn't been studied critically. So we're actually doing studies as we speak that are looking at people that have had the diagnosis of sleep apnea and seeing whether or not these Ozempic and Mounjaro-like drugs actually help you sleep better.
Right.
Imagine that. So that's a question that's unanswered that we're trying to answer. We're also doing things, we don't just work with drugs, by the way. So we do studies with microbiome transplants. Who's heard of a stool transplant? Has anybody heard of that? Yeah, so imagine that, taking somebody else's stool and putting it into your colon. Well, it turns out that the bacteria in your gut are very important for your health. And if that becomes unhealthy, there may be ways of making it more healthy. And that can help people that have inflammatory bowel disease, such as ulcerative colitis. It may help with weight loss. It may help with irritable bowel. So we're doing a lot of work with our colleagues at Borland Groover on those kind of questions. And speaking of that, there's a lot of cross-pollination between different specialties now. So interestingly, we're looking at doing a procedure in your intestines to see if it can change your diabetes or cure you of diabetes. So it turns out that the cells in the duodenum are responsible for absorbing glucose and other carbohydrate type components. Well, if you reduce the number of cells that are doing that, can you change somebody from being diabetic to being non-diabetic? And if you're interested in that, if you have diabetes, we actually are enrolling in a study that's looking at that specifically, including a procedure. And of course, all this is free of charge. We have external study grants to cover all these questions.
Thanks for joining the MedEvidence podcast. To learn more, head over to medevidence.com or subscribe to our podcast on your favorite podcast platform.